Good morning, everybody. Could you try and find a seat, please? And then we can start. Just wait for the final people to come in. Okay, I think we can start. And welcome to everybody here in the room. This was our introductory video clip that we presented in January, when together with the Skippers group, the Healthy Livestock Project organized an online event where we invited everybody to come to Bologna today for an industry day on the use of antimicrobials, or rather the reduction in the use of antimicrobials. I have a short presentation, which hopefully will, yeah. Seen that? Okay. And I can use this, can I? So welcome everybody here in the room, about 30 people. Online, I just heard we have nearly 50 people. We expect that one or two more will join, but I think it's a great turnout. And I'm looking forward to a very nice day ahead and discuss this very important issue. My name is Hans Spolder. I work at Wageningen Livestock Research in the Netherlands, and I'm the coordinator of the Healthy Livestock Project. And I'm joined in a minute by Joost van den Borne. He's from the Skippers group, and Joost will take over from me in a minute, but I'll just explain to you first a little bit about the Healthy Livestock Project, and then you'll hear more about today's program. So first of all, about the objectives of our project. It's a project that aims to reduce the use of antimicrobials as it's applied by the pig and the broiler industry, not just in Europe, but also in China. And of course, the idea is to reduce residuals to prevent antimicrobial resistance from increasing. And our main aim, also part of our passion, is to try and do that by increasing the level of welfare of the animals on farm, increasing the health conditions overall on a farm. And as you see, it's a joint meeting together with Chinese colleagues. And we have several Chinese colleagues online who, unfortunately, due to understandable reasons, travel restrictions and Corona, you all know about that, unfortunately couldn't attend the meeting here. But yesterday, our part, the consortium part that's residing in China, also joined us for the whole morning. And we had about 25 people or 30 people from China joining us, which is good. The time difference is such that for them, it's now 6 hours later, so you can work it out, 3:30 in the afternoon. And they probably are going to be here for the session of this morning only. Our meeting is also live streamed in China, and they expect more than 1,000 people to look at it. So be at your best behavior, just in case the camera is pointed at you. The world is watching, at least in China. What we do together with the Chinese consortium and the European consortium is try to find ways to reduce the need to use antimicrobials. There are two parallel projects, and I liken it a little bit to a ladder where you have two standing posts, and there are connections in between on various issues where we exchange information and exchange knowledge, but together we try and climb to a higher level. And this is the team when we met in Beijing in 2018 for our kickoff meeting. And it's not just academics, just to let you know, there's also a lot of companies involved, both in China with some very large producer groups, but also in Europe, where we have companies linked to the project. Healthy Livestock project is based on 4 strategies, and these strategies will come back in the morning program, as Joost will explain later on. We start from the assumption that if you don't get any pathogens on your farm, you should also not have the need to use antimicrobials. So the first strategy is to get your biosecurity up. The second strategy is, if you get a pathogen on your farm, your animals should be resilient enough to be able to cope with the pathogens, to resist the pathogen. So resilience is our second strategy. The third strategy that you'll be hearing about is that if an animal becomes diseased, you want to know as quickly as possible, because the earlier you know, the earlier you can take remedial actions, and hopefully again, the less medication you need. And the fourth and final strategy of the project is to do precision medication, targeted medication, or provide alternatives to medication. Once again, to reduce antimicrobial need. All these 4 strategies are developed into different experiments, different studies, but also into different products and outcomes of the project. And today is very important for us to also hear your view, to come with your ideas on how we could write our final report, because our final report is about to be, will be written in the coming months, because the project finishes in the beginning of next year, on the 1st of March. So we have about half a year, nearly 3/4 of a year to conclude on our findings. This is also then the right moment to share with you what we have found in the past 3 years of the project. And it worked like this in the project, that we have different work packages on biosecurity, resilience, rapid detection, and precision medication, as you can see on the left. They lead to welfare innovations. They lead to health and welfare plans. And these are then tested in a work package that we call validation. They're tested for their economic value. They're tested for their consumer and farmer acceptance. We look at the effectiveness. Does it work? And all together, we then get a good idea of our solutions, how their impact will be and whether they are useful or not. Finally, dissemination is sharing all this information with you and with other people who are interested. And we are now here between work package 5 and work package 6. So most of the outcomes of the research is done. And now we want to communicate and take it further to the dissemination phase. So today you'll be hearing, at least from our project's point of view, about ear tags that monitor the behavior of individual pigs, about group behavior and how tail biting can be monitored remotely to identify it early, broiler weighing platforms to see how the weights of the birds and the activity levels of the birds are affected by disease incidences, but also a new way to monitor the biosecurity on your farm, and several other things more. So from my point of view, from the Healthy Livestock point of view, once again, a very warm welcome to this meeting. I hope you enjoy it. And then I'm pleased to introduce Joost van der Borne, who will take over from me and chair the first part of this meeting. Can I go to the next slide? Yeah.
Yes, thank you very much, Hans, for introducing, and also a warm welcome from our side, from the Schippers Group. I'm working at this company as an R&D director, and next to that, I'm also associated with the Haas University of Applied Sciences as an associate professor. So that's my my background. Next slide, please. We are very keen to have projects like this, like the Healthy Livestock Project, because it generates lots of knowledge on from veterinary sciences, from animal sciences, how to deal with the issues that just have been introduced. But what's also important is attitude, to be able to apply knowledge. We are working from the industry point of view on products, on techniques to connect to the knowledge. But the attitude, the mindset of farmers, of veterinarians, and the context in which they operate is key to success. Because if those two combine, next one, please, then this will also affect behavior. So behavior of people working in the livestock industry and also working on the topics that we need to work on. Can I have the next? Yeah, now it's working. So having a similar objective, having similar aims for the project, but also the industry, the farmers community, we thought it would be very nice to also work together, to join forces in dissemination, as Hans already explained, but also in bringing knowledge to practice and also bringing practice back to the academics. So that's why we organized in the beginning of this year a joint seminar. Had a lot of participants there from also more than 60 countries. The webinar is still available, and some of the insights from that webinar will also be included in today's program. Well, a very short introduction about the company I'm representing. The Schippers Group. It's a family-owned company existing more than 50 years, working in the international livestock farming industry, having more than 500 employees. 12 offices worldwide, and we export to more than 90 countries. And as you can see at the right bottom of this slide, one of the objectives, or actually the key objective, is to beat AMR. And that's something that we aim to do with what we call high care. So, well, what's high care? We typically try to explain that by using a kind of pyramid, where if an animal needs antibiotics, of course, it deserves antibiotics, and we have to provide antibiotics. But we think that a lot can be done in prevention, and prevention means hygiene, care, and vaccination. All three are very important. We are working on the lower part of this pyramid, so on hygiene solutions and on care solutions, because vaccines are also quite costly. So aiming for reducing infections and enhancing resilience of animals. We do this from the Netherlands, and that's quite a particular situation, challenges that we are facing in our country. As you can see on this slide, the livestock density in the Netherlands is the highest of all European countries. So this also brings about a lot of different topics and challenges. Challenges related to the environment, like, for example, the nutrient cycles, emissions, water scarcity, to health, like antibiotic resistance, we are discussing today, zoonotic diseases, and challenges related to animal welfare. Of course, today we will focus on the AMR, on the antimicrobial resistance, but we cannot disconnect it from all other themes because it's very much interrelated. That's also what we do in our research programs on 3 different experimental farms, our own laboratories, that we can test new products, new concepts in order to make them ready for the international markets. Well, being in Italy, I thought it would be nice also to quote an Italian, of course, so Leonardo da Vinci. And I think it very nicely connects with the objective of our collaboration with projects like the Healthy Livestock Project. And the quote is, "I've been impressed with the urgency of doing. Knowing is not enough, we must apply. Being willing is not enough, we must do." So I think it's very nice in this phase of the project where you're aiming at dissemination, that we also, as the industry, as the farming community, also try to get the nice ingredients from that project and to aim for application in practice. Well, a bit more about today's project, program. We have a very full but very interesting program, I think, starting with a keynote lecture of Keith Sumption from the FAO. I will introduce him in a few minutes. And then at 10:15, we'll start with the biosecurity session. Each session has a similar setup during the morning. It starts with an explanation of the project outcomes. Then we have pitches from the industry and from science. And we have some time for discussion. I have to stress that it's a very full program because the pitches only take about 5 minutes. So it's a very short program. Very short pitches, but a very full program. A lot of information will be shared. Then we have a session on resilience. And after a coffee break of 15 minutes, we will continue with the strategy, early detection, and concluding with precise and alternative medication. That will be the morning program. At 1:30, we'll have a lunch and also digital poster presentations of 1 hour. And after that, we will continue with a roundtable discussion. And then after the roundtable, we will split up over 2 thematic sessions, and we'll do that in 2 rounds. So in the first round, we have a session on regulation and surveillance, and QA, a threat or an opportunity. And alternatives for antibiotics. Do they exist? And if so, which are the most promising alternatives? After a coffee break of half an hour, we will continue with the second round of thematic sessions, of which one is prevention of disease, stockmanship, or technical solution. And the second one is early detection and precise medication. Which novel techniques are feasible and robust in practice? Then we will close the formal program, and for all physical participants here, we will continue with some drinks and food in the venue. So far, the introduction of the program, and then I would like to continue with the keynote lecture by Keith Sumption. We are honored to have Mr. Keith Sumption. He is Chief Veterinary Officer of the FAO, the Food and Agriculture Organization, and leads the Animal Health Program, NSAH. He's a director of the Joint Center for Zoonosis and AMR. Mr. Sumption has worked on disease ecology and the interaction of wildlife, domestic animals, and the environment for more than 30 years. He has acted as a research team leader for 12 years at the University of Edinburgh and in DFID in Kenya, and worked for more than 17 years on epizootic diseases as a secretary of the EU Foot and Mouth Disease Commission based at the FAO. I would like to give the floor to Keith Sumption. It's an online presentation, so we'll have to switch to the online connection now. Always challenging technique. I hear there's no connection yet. What we can do is we can start with the first session then, and if Mr. Sumption comes in, then we can switch. Yeah. Okay. Then I would like to invite Kees. I would like to invite Kees de Roest for chairing the first session.
Thank you, Joost, for this. Yes, the first session will be presented and will be dedicated to biosecurity. My name is Kees de Roest from the Research Center for Animal Production. I will moderate this first session on the first strategy of biosecurity, and there are 4 pitches, presentations, and the first presentation will be done by my colleague Paolo Ferrari of the Research Center for Animal Production, please. He is responsible in healthy livestock for the biosecurity strategy, and he will present a pitch about the work which being done in healthy livestock on biosecurity. Please, Paolo.
Thank you, Kees. This presentation is aimed at summarizing the main outputs of Work Package 1, which was which was carried out in collaboration with okay. Yep. Sorry. Okay, thank you. We can start now. So as I was saying, I would like to summarize the main outputs that we got from Work Package 1. And Work Package 1 was it was about biosecurity, and we had European partners. So CRPA, together with the INRAE and NONIRIS from France, Wageningen University of Research from the Netherlands, VTN from Greece and Cyprus, and also Chinese partners were involved, DBN and CAP and HLH. They did something similar to what we did, and they also developed an app for biosecurity assessment. This work package was aimed to reduce the risk of pathogen introduction, exposure, and spread on modern intensive broiler and pig farms in China and Europe through the development and application of tailor-made health biosecurity protocols and health plans. So what we did at the beginning in task 1 was to develop 2 biosecurity analysis tools for broilers and pig farms to assess systematically disease risks related to housing and management, to define farm tailor-made health plans, and including biosecurity protocols in which a number of biomarkers were included to monitor the health state of the animals and to monitor the risk mitigations. So the biomarkers are defined as markers or indicators of a biological process or pathological states, providing information on the current status of future risk of disease of an individual. For broiler farms, the main indicator was the food pathogen score, which is acknowledged as the main indicator for the welfare and health of broiler chickens, and also an indicator of the quality of the litter and of the environment in which the chicken are kept. Whereas for pigs, for pig farms, many more biomarkers were used for different categories of pigs: sows, piglets, weaners, and fatteners. And those biomarkers were the respiratory scores, so scoring the representative samples of the pigs for each category. And whenever the score was higher than a certain threshold, samples of blood or serum were taken from the pigs to check for PRRS presence. And the same for feces scores as an indicator of enteric problems in the animals. And other indicators, well, the skin and plaque scores at slaughter. And this was done at slaughter to check if there were evidence of some diseases in the animals slaughtered. Other indicators were haptoglobin in the blood and serum of weaners, cortisol and the dihydroepiandrosterone, which are two stress hormones in the pig hair of different categories, and also mortality rates for all the animals. And this was done, every farm was visited 3 times. The first time to do the biosecurity analysis, and 2 times more to check for the changes in the animal management and implementation of recommended practices according to the biosecurity analysis, and also to collect data about antimicrobial use, to monitor the antimicrobial use, and also economic data and some samples of manure, meat, and drinking water, which were analyzed for antibiotic residues. And this was analyzed in Work Package 5 together with economic data. The biosecurity risk analysis tool that we named BEAT as an acronym was based on 2 conceptual approaches. The first one was the BioCheck Ghent. This is an elaborate of the University of Ghent, which was used in many countries, Europe and outside Europe. And it is aimed at assessing through some checklists the external biosecurity and internal biosecurity. External biosecurity is the biosecurity aimed at avoiding the introduction of pathogens in the farm, whereas internal biosecurity is aimed at avoiding the spread of pathogens once they are introduced into the farm. And the second approach was the FAO 3-zone biosecurity model. As you see in these figures, 3 different, not in internal or external, but 3 different zones are considered and their interfaces. So the red zone, which is the public area around the farm, the orange zone, which it is named also the professional zone, where the staff, people, workers, vehicles, equipments move between buildings and animal houses, and the green zone, which is the animal houses. And also other 2 zones are the interfaces, so the transitional zones, so the gate to enter from the red zone into the professional zone, and the gates to enter the animal houses, which are particularly important to avoid the spread of diseases. And in pig farms, 20 French farms, closed cycle farms, were assessed, and 20 Italian farms. The Italian farms were different because we involved 1 sow farm, 4 weaner farms, and 15 fattening farms. So there we cannot compare, but we can compare the scoring. So you can see here the scoring for the BEAT scoring average for French and Italian farms in visit 1 and visit 3. So after the monitoring period. So we can see here the changes that we got in the scoring of biosecurity. And we can see that there is in the red zone, there is not much change because it is a public zone where the pig farmer and broiler farmers has a limited power to intervene, except for the parking, for visitors, for the staff. But in the French farms, major improvements were achieved in the transitional zone from the red area to the orange zone. And it was due also to a recent regulation which was applied in France in relation to African swine fever in terms of perimeter fencing and the hygiene lock. The hygiene lock, so the place where the people entering into a farm should change and wear overalls and boots, and clear distinction between dirty and clean areas. In Italian farms, major improvement was achieved in the professional zone in relation to the rodent control and in relation to the management of cadavers, of mortalities, which can spread the diseases across the farm. The other transitional zones are related to the use of overalls to enter the farms for visitors and staff. And the green zone was main intervention were related to the management of sick animals and feed storage. Please.
There's a question in the chat.
Yeah.
How was the farm size in France?
How the
Was the farm size in France and Italy?
farm size? Well, it depends. Yeah, there are different. I've not the figure here, but we can provide, of course. So there are the farms are not representative of the farms in each country. So this is important to say. But they were in Italy. They were somehow connected in to the farms. So there were farms owned by a farmer, and some other were integrated by the main farmer.
We still have 2 minutes.
Okay. It doesn't work. Okay, so antimicrobial use was also calculated, and you can see here the blue histograms are French farms, and the green one are for the Italian farms, for different categories. And we can see here that the main use for piglets and weaners was used in French farms, with respectively low increase and decreasing, whereas in Italian farms, main use for weaners with a decreasing for weaners and finishers. And the main intervention were, just to speed up, were low cost done in short term, medium cost in short term, and low cost done in medium term. We can see now for broiler farms, 13 farms were recruited in Netherlands, 10 in Greece, and 7 in Cyprus. And as regards the antimicrobial use, we have seen that a reduction of antimicrobial use was found in Cyprus, where in 4 consecutive production cycles, it was observed that the days of treatment was reduced, and also the number of farms using antimicrobials was reduced. So what we can draw from as a conclusion is that biosecurity analysis tool was found effective to identify biosecurity strengths and weaknesses of pig and broiler farms. Assessment with BEAT was a good starting point for the making of tailor-made health plans for each farm in agreement with farmers, and most important, with their vets, including targets in terms of intervention plan that could be checked and updated in the medium and long term as an ongoing process. Although antimicrobial use cannot be linked to biosecurity only, a reduction in antimicrobial use is reported for broiler and pig farms with higher use of such antimicrobials, such as in Italian fattening farms and weaning farms and in Cypriot broiler farms. However, it will be interesting to see the long-term effects in the future. Chinese partner did more or less the same as we did, but they also developed an app which is running on the WeChat application. And this app is able to make the assessment of epidemic disease risk in intensive pig and broiler farms. It is able to provide also suggestions on risk management measures to help pig and broiler farmers to improve biosecurity and reduce the risk level. And they expected the Chinese colleague to complete this app within 2 months, and they will use that to make a risk assessment in more than 40 pig farms and 20 broiler farms in China. And it will be promoted as a common biosecurity management tool for pig and broiler farms, to realize self-assessment together with their vets, as a way also for early warning and improvement of biosecurity on the farm. Currently, this application is in Chinese, but it will be translated into English also.
Okay.
Thanks for your attention.
Thank you. Thank you very much. Thank you very much, Paulo. We will now give the word to Keith Sumption, because he is now able to join. For questions to Paulo and also for questions related to the biosecurity issue, at the end of the session of biosecurity, there will be 15 minutes time for all questions, both from the audience as well as for those who are connected in streaming. So, but now, as Mr. Sumption is available now, we will give the word to him now to present his presentation. So please, Mr. Sumption, you have the floor.
Thank you very much indeed. I hope you can hear me okay at your side. I would like to ask if we can let me share my screen, because I think it's at the moment it's disabled, so I'm not able to do that. So if somebody could enable my screen, it would be useful. But firstly, to say, while we're waiting for that to happen, even though I only have the chance to catch parts of that last presentation, it just sounds such a perfect combination with what I'll be saying next, and how much we can learn from the work that you're doing to reduce the need for antimicrobials. Okay, thank you for letting me join the share my screen. I'll do that now, and I hope I won't keep anyone from coffee. Okay, so I hope that's coming through okay. So reducing the need for antimicrobials for healthier agri-food systems, this is really becoming mainstreaming what you're doing, I would say, within the thinking that we have in our role as part of the quadripartite, the international organizations, but with particularly the role on the side of FAO. In terms of I think everyone will know, and I don't want to speak only in generalities here, that there has been there is a dramatic shift taking place in terms of the amounts and growth of global meat production. This is actually a faster growth than the growth in the human population. So meat production to meet the demands has been leading to a lot of sort of structural changes. In terms of the estimates of antimicrobial use, then there is perhaps to the medical ears a sort of shocking figure in terms of the amount of all antimicrobials sold being used for animals that are raised for food. And as part of that, we also have to recognize the potential impact on the environment, including the soil biodiversity, by the fact that most things we give to animals go straight out of their bodies and are excreted in urine and feces, and that will then go. And some of those have very, very long persistence, maybe 1,000-day half-life for some of the antimicrobials. So we do have to take into consideration what we do in animals has a much bigger and broader context. Livestock systems are increasingly shifting to landless systems, and that's in particular in terms of pigs and in terms of broiler. And there is a difference in the amount of antimicrobials that are used in different systems, so that we may think that, well, in cattle production, it's relatively low amount of antimicrobial use compared to chickens and pigs. But, there's still a significant amount in each of those systems. So in terms of increased animal production drives, the types of thing which I think you are considering, but you're getting very practical, and I love that, is how do we address the reasons why antimicrobials are used to start with. I mean, we fully concur with the idea that this is not a problem that you will solve by simply wishing away that veterinarians and others would use less antimicrobials. They're used for valid reasons, and some of those reasons we need to tackle. And they include the extent and of the disease burden, difficulties in terms of water, sanitation, and hygiene in systems, lack of awareness, maybe part of that because they become part in some areas of production practice. There is an overuse we can consider, but we also have to consider the reasons for the use includes the actual need to control infection. So infection prevention and control is not just important on the human health side. We really have to focus much more on why antimicrobials are used. And that includes that we have a wide range of agents causing pneumonias and other diseases for which we don't have access to appropriate vaccines, or potentially in some areas there is a lack of entry of vaccines into that market to be able to deal with that problem, or simply they're not going to address the number of agents involved. So we do have some data from different systems, and just one example here in terms of studies in Thailand does indicate that there's a difference between the amount of antimicrobials which are used in medium scale farms, the costs per pig in terms of the spend on antimicrobials and their use in disease prevention. The level of resistance also tends to be higher in medium scale compared to small scale farms. Now, we're not saying we should go back to being small scale farms. We have to address the reasons why antimicrobials are needed. I will sort of not go on to let's say the sort of global trends, but let's consider that antimicrobials are also used not simply in people and in animals, but in terms of crops as well. And that's one of the other roles of FAO, is sort of looking at the use of antimicrobials where they're used in crop protection and reflecting that also goes into the environment, and those environments and it will also be ones in which animals are kept, particularly in more extensive systems. So putting all those things together in terms of human population, intensified production systems, increased prevalence, we do need to do something about it. We do need to learn from successful efforts in this field. So I think what you're doing, the members who are presenting, is very pertinent to sort of learning what is it that will drive a reduction in antibiotic use, antimicrobial use, and how does that relate to reducing antimicrobial resistance. So this may be one example that was very familiar to some of the speakers. There'll be other examples that you will bring from your efforts, which we are very, very interested to listen to. So in terms of what we see as these sort of two main areas that we may have to focus on is minimizing the incidence of infectious disease at farm level. I think the last speaker was talking about that, and that's really great to hear it. And the second one is a more prudent application of antimicrobial therapy where other prevention measures have failed. So with that, we have to think, have we really got the right conditions to reward prevention compared to dealing with treatment? FAO's plan on antimicrobial resistance is strongly linked to the plan together of the quadripartite, and it has these different 5 areas which are quite broad, but they're areas which at national level we are supporting countries to make their national action plans with the animal health sector, crop health sectors very much engaged. But how do we turn that practically into something that begins to change realities? So we've really been thinking about a global campaign. This is not yet in existence, but this is a great sounding board to have this meeting. And I'm glad that my colleagues are able to join you today. So that's really thinking about how do we tailor the things that you're doing and talking about, but how do we support countries to go through that transition themselves, focusing on farmer producer level experience, knowledge, practices, and the enabling environment around. So there's a whole range of things that we can bring in that we consider bringing in the One Health approach, focusing on and I won't go into these ones here, but the world can look a bit complex, but we have to make it simple, and we need to focus on the things which are most effective for work. So we need to bring out from these different approaches something which will really be tangible to do something significant at the farm level. So I think that's what you're talking about, and that's what we're happy to talk with you about. And I'm sorry I can't join you for more than this brief intro. But if we place the farm level experience and farm level perspectives, the farm level needs, what can we do better that will help them to reduce the needs? What can they do better, and what are the incentives? So around the farm level, you have the different options from biosecurity, better prevention, use of vaccination, husbandry and health systems appropriate to the achieving health in the different stages of an animal's life, and nutrition and its role. Around that will be the national enabling environments, and those things we have traditionally focused on, but sometimes not really with the focus of achieving an enabling change at the farm level. Around all of it are these, let's say, international supporting mechanisms that will help national authorities help to create the kind of policy framework, help to be able to compare data between countries that we're working on at the moment. So going back to the area of how do we support change at country level, one of the things which is similar to your work, but is actually taking through what happens really at the level of farmer and their connection to health services. What can we do better? So we've got an approach that we've used where we can better understand policy change, what it might mean in terms of praxis, and the way that would be enabled to change in terms of the relationship of producers and those who provide them with prevention services. And this also helps us introduce other things, even things like environment-based metagenomics work, with an understanding that this is going to inform whether some of these approaches at country level are going to work. So thinking about, and this is where it's good to have a dialogue, thinking about how do we scale up something like you're doing, but actually connect it to similar issues in other regions, similar issues on any farm in terms of its relationship with creating healthy livestock. So we have a bit of a broad vision that to really make a change, we're going to have to engage a lot of countries to be thinking about these farm level changes. And we're saying 100 countries, we would like to see this approach in the national action plans. We believe that if we make those changes, then over time we can see a reduction in the amount of antimicrobials used. And we've got some sort of outlines simply because we needed to think about, are we going to achieve scale? What number of farms would they need to be involved, or small, of medium or appropriate size? And how do we ensure that all those who are providing those services are engaged in the same thing, but actually they have, as service providers, their bottom line is they need to survive as well. So we do think there'll be a range of benefits which are not simply to health, but in the end, the benefits have to be at farm level as well. And that's going to need to be one part of our story is, can we make prevention and reducing the need, can we make it pay better than what we do at the moment? That's important. So how do we also bring the stakeholders together internationally? One thing that we're launching this year with the other organizations is a partnership platform, which will enable us to take areas where there needs to be multi-stakeholder action, bring them to the level of a partnership platform to discuss these kind of targets that I've been describing before. So we believe that one of those action groups, once the partnership platform is running, one of the partnership action groups is probably going to be around reducing the need for antimicrobials in livestock production systems. So that's where we see it fitting together. So we have a lot of questions, and I think a number of the, and really the expertise in the room is going to help us with that. And I'm glad that we have this chance to talk about it. Trying to understand what would be the drivers for livestock owners, livestock risk managers, livestock producers to be part of the change, champion it, see the benefits from it. How will we engage private sector associations, private sector, very much more in the answer? How can we increase the let's say the buy-in to the concept? You know, do we need to focus on healthy livestock first? Secondly, reduce antimicrobial use as a result of healthy livestock. So it's also about the narrative that everybody wants to be part of. So economic success stories coming from changes from the farm level upwards would be great, and we will learn from them. And finally, how does this relate? If we focus on reducing the need, can we also show environmental and other benefits as a result of this? I believe we can if we get this right. Thank you very much for this opportunity to speak.
Thank you very much, Mr. Sumption, for this very interesting presentation. I would like to give the floor to some questions to you, of course. Please, Birgit, there is a question in the chat.
Yes. Is the mic on? Oh, yeah. Any idea what proportion of global antimicrobial use in agriculture is in crops? And is its role in driving AMRI to reduce the same as antimicrobial use in farmed animals?
Great question. I don't have the figures to hand, but I believe from my memory, it was something like 2 to 4% of antimicrobial use. So it's not zero, but it's not very large compared to, let's say, the livestock contribution in terms of total amounts. We can argue that it is maybe more directly being applied to the environment. You know, essentially, you can't hit an orchard tree with streptomycin with only it reaching the tree and not the surrounding environment. So there is a different maybe sort of aspect of its contamination of the environment. I can't really answer the question whether we can really attribute the amount of AMR, but I think that's one where we need to look into it more. Thank you.
Other questions? Yes, please. Bas Kemp.
I'm Bas Kemp, Wageningen University. Very nice presentation. Thank you. I was wondering, I think that one of the successes in the Netherlands was that actually the preventive use of antibiotics, the automatic use of antibiotics in the production system was more or less abandoned. The way that people say, okay, we're going to wean the piglets, let's do that under an umbrella of antibiotics, is something you could often see. So, and I think that benchmarking was one of the things that may have driven this system. But are you also aiming at that part in your campaigns to try to get the preventive use of antibiotics lower?
Yeah, no, that's a really interesting discussion. And I'll link it to something that's in the chat as well. Should we use the terms antibiotics and antimicrobials as synonymous? So take cattle production in most of Africa. To keep those animals alive, you need to use tick control. Now the ticks have become resistant in many areas to the things which are used to kill them. So by the same processes. Now with the lack of tick control comes a whole lot of abscesses on the animal's face. So how do we prevent the use of So antibiotics, in this case, get used to treat something which starts in the resistance of parasites to antimicrobials. So we have a bit of a debate sometimes because antimicrobials is broader. Tick resistance may not be a human health threat directly, but it is a cause of use. So we have to get behind in each of the settings what is really driving these preventative uses. Is it something itself that has to be tackled? It's often a bigger problem. So one of the areas more tangibly is the type of things you're discussing in terms of tools to assist livestock keepers to know if they are using more or less antimicrobials than farms of a similar production and biosecurity setting. And we think that's a way of getting into that issue. I know regulation has become it has its role as well, but we must not, as an international organization, forget that the disease burden faced often in low and middle income countries is set by the tropical environment, the different disease settings, the lack of vaccines for those tropical diseases, as well as things which are common elsewhere. So it's not a level playing field for removing, but it's very much part of what our thinking. Can we remove preventative treatment?
One last question, I think it might be possible. Is there still another question to Mr. Sumption?
Yes, sure.
Please.
Sorry, is it a spoken question? I think I've answered the on the question in the chat. Antimicrobials are what we use now because antimicrobials, both in human health, refer to the fact that we have resistant parasites such as malaria, in our case, resistant protozoal and other infections which are not bacteria. So antimicrobial resistance is used because it has both human health, has a broader spectrum of agents which we have to manage who have developed resistance. Thank you.
Yes, one question, please. Yes, Mr. Jürgen Hartung.
Yeah, thank you very much. Very good figures also to remember, which you presented. My question, so I'm Jörg Hartung from the University of Veterinary Medicine in Hanover, in Germany. What is the position of FAO, I think, in the quadripartite system regarding the use of antibiotics in human medicine? Because most cases where you have resistance, and we are talking about the health of humans, and are coming from the use in hospitals of antibiotics. So I assume you are working together with the WHO and all the other organizations also to reduce antibiotics and anti-infectiva in general in this connection.
Yeah, we are. We don't have a position where we say you guys in medicine need to do a whole lot better because it's affecting our constituents in agriculture. It's clearly affecting, there is a direct connection, of course, when you've got farm workers who are exposed one way and another. But they are doing very, very similar things. And I won't say that we have here in our focus brought it to that level, but I think it's part of your discussion at this meeting is really the agents involved in prescribing, using, and demanding antimicrobials. Many factors are similar between those drivers that we have to get behind. Some of them are the level of risk of specific infections in hospital and other settings. So I think we have very similar thoughts, but perhaps I would say with WOA, the old OIE, we've really kind of been a little bit focused on the national level when human medicines also need to think about the actual environment, the connection between the user of antimicrobials and the prescriber. I think that's what you're doing, is to focus on that side. The thing that helps us, maybe what we need to see increasingly, is the kind of work which is measuring environmental waste and attributing the antimicrobials entering water courses as whether they come from a farm setting, they come from hospital, clinics, and other use. You know, that gives, there's an increased interest in using that as a way of saying, you know, that around a country, we may have to do something about both sectors, but we need a bit more objective way of measuring what comes out from those settings into, you know, the common environment, which is water that drains off agricultural land or comes out of hospitals. And that gives us a bit of an interest or a handle on some of these questions of attribution.
Okay, thank you very much, Mr. Sumption, for your interesting presentation. And the consortium is, I think, very happy to collaborate with FAO in the future on these issues. And thanks a lot again. So applause for you again for your presentation.
Thank you. There is a questioner on the online, Motuma Debello. I leave it with you, Chair, to decide on that.
Okay. If you can reply directly, perhaps in the chat, to then we can continue. And I would like to invite you, if you still have time, to follow our conference. If you can, we are happy that you will continue to join us. Thank you very much.
My colleagues are there with you, so
okay.
Please,
Thank
they'll take on. Thank you. Thank you very much.
Thank you very much. Bye-bye. Thank you. Okay, then we will continue with the session on biosecurity. We have almost 25 minutes now, and we are having other 3 pitches. And the first of the 3 pitches, after the one we have heard of Paolo Ferrari, is Marcello Beltrao Molente. I would like to ask him to come forward for the presentation, or to present it by streaming. By streaming, okay. So this presentation will be on the teaching the next generation of young minds about holistic and transformational animal health. Please, Marcello Molento, you have the floor.
Good morning, everyone. It's a pleasure for me to present my pitch. Are you hearing me well?
Yes. Can you please present yourself, what you're representing, please?
Can I have the slides, please? Or I can share my slides as well, of course.
Okay, you can share your slides.
Excellent.
Okay.
Okay. Yeah. Thank you. Yeah. The title is a bit long, but what I would like to talk is regarding education. And as most of us are related to academia or research, but coming from academia, it is interesting for us to cover that topic. Otherwise, young people will reach the subject, or will get into the subject too late into their careers. So the idea was to bring a subject that is very much connected to global health. I'm a veterinarian. I work in Brazil in a university called Federal University of Paraná in the south of Brazil. And we teach in the university. So 5 years ago, I started the Global Health Initiative at UFPR, and we are covering holistic farming based on transformational animal health strategies that might be used to control antimicrobial resistance. I work with drug resistance for the last 25 years, focusing on antiparasitic diseases. But it's an enormous issue worldwide already. So transformational Animal health brings disruptive technologies sometimes that must be taught to students very early in their career, and covers worldwide biosecurity issues. Teaching technique, of course, can help professors to introduce topics such as resilient farming, and resilient farming is also a very complex set of technologies. Okay, so and also problem-based learning is essential to keep the plasticity on young minds, which is very nice as well. So the objective of this pitch is to describe the opinion of 45 students that took global health discipline, and how the experience that they had will improve quality of life in the future for their life in their professional life. So as a result, I interviewed 55 students mostly from South America, of course, Argentina, Brazil, Chile, Colombia, and also from other parts of the world, such as Africa and the Middle East, including refugees and other students that came to Brazil. It's a full time course, 60 hours. We used EMI, which is a platform that relates to English as a meaning of education. And we cover ecotoxicity, community well-being, plant-based, bio-friendly pest control, phytotherapy, and other issues as well. We had them answering two sets of questions, and we had a bunch of different professionals taking the course. So this is a conceptual map regarding the global health alternatives, and you will see that we have plenty of raised subjects that will cover water sanitation, sanitation as well, animal products, diseases, environmental toxicity, pollution. As in conclusion, because my time is very short, the transformation of agricultural health must be considered when discussing antimicrobial resistance. The students used problem-based learning. The technique help them extremely well to argue against intensive farming. The group had a common opinion that private sectors and the industry and government and the civil society must work together. Antimicrobial resistance might not be reversed, because I also work with reversing drug resistance, but it can be slowed down significantly by reducing intensive farming. Holistic farming can contribute to control of diseases with prudent use of antibiotics, and I leave the floor open for questions. Thank you so very much for the opportunity.
Thank you very much, Mr. Marcelo Molento. Questions to Marcelo Molento can be posed after the other two presentations. So please collect your questions for Mr. Molento. Then I will give the floor now to Joost van der Borne, who will do a pitch about enhancing the efficacy of cleaning and disinfection at broiler farms. Please, Joost, you have the floor.
Microphone, yeah, okay. Can I have the slide there, please? Yeah, but it doesn't work. Doesn't work. So. Can you please put the slide on? Or? Okay. Yeah. Okay. Yeah. Okay, I'll be patient. Yeah. One back, please. Yeah, perfect. Thank you very much. Yes, ready? Okay, thank you very much. Yes, I have to acknowledge some other people for the presentation I'm giving today, mainly Lizzie Karine and Stefan Verhoeven, who have conducted the research. And the research was on enhancing the efficacy of cleaning and disinfection at broiler farms. Can I have the next slide, please? Yes. First, a short background. We have been applying an integrative health approach called High Care, which I explained in the beginning, on a large number of farms. And there we have implemented 5 different pillars. Clean living environment to reducing infection pressure, pore-free surfaces, a pest-free shed, optimal care, and clean drinking water. So it's not a single treatment, it's a full integrative approach on broiler farms. Can I have the next one, please? And there we saw quite some good technical results. Doesn't work. Yes, now it does. We saw some quite interesting technical results because when comparing it to conventional broiler farms, we saw a reduction in mortality of about 0.02%. Antimicrobial use decreased by 20%. The feed conversion ratio decreased by 6 points. And we had less contamination in the slaughterhouse. But still, we also did a risk assessment on our integrative approach by students from University of Applied Sciences. And they came up with a very interesting finding. And the finding was that when we had the cleaning practices, we still see some contamination in the feeding and the drinking lines. But if we look at the process, how it occurs in practice, we see that it's all manually done. So it's done by farm workers cleaning all these systems. And we thought, well, can we develop something to solve this challenge that we still have contamination in the feeding and drinking lines? That's why we did 2 different research lines. The first one was developing a semi-automatic device for cleaning the feeding and drinking systems. We compared that in the experiment versus treatment, so the manual cleaning. And we also did some measurements on the organic contamination and the aerobic cell count after the cleaning and after disinfection procedures. Second, what we have been doing is seeing if the contact time of a cleaning agent would affect the efficacy of the cleaning product. So there you see on the right hand, you see this foam, and this foam can make contact time longer between the product, the chemicals, and the contamination. We did that for 0, 5, 10, 20, and 30 minutes contact time. And we did a similar type of measurements. When looking at the results for the semi-automatic cleaning device, we saw that it improved ease of work. About half of the time was needed for the cleaning, and nearly 40% less water was used. We also saw quite a big effect on the organic contamination, so being able to reduce that versus the manual cleaning. And the aerobic cell count was also lower after cleaning compared to the manual cleaning. If we look at the contact time of the cleaning agent and the contamination on the right hand side, you can see the conventional product, which has a contact time of about 5 minutes because it foams for 5 minutes, and the experimental product, which has a longer contact time of nearly 30 minutes. We saw that contamination reduced by 72% up to 20 minutes. So 30 minutes relative to 20 minutes didn't make a difference anymore. and the cell count reduced by 65% after cleaning and tended to reduce after disinfection, but that was not statistically different. And therefore, it was the longer the contact time is between the cleaning agent and the contamination, the better the effect. So those are the results that I would like to share for today.
Thank you very much, Joost. Very interesting results, I think, to reduce the use of antimicrobials. And I would like to give the floor now to the third and last presentation in this session to Mrs. Elke Burow. She will present on streaming online. And please, you have the floor. You can present your presentation sharing the screen, I presume.
Okay. Yes. Can you see it?
Yes.
Can you hear
Yes.
me?
Perfect. Yeah.
Okay, fine.
Maybe you can put it in full screen.
Yeah. Can you see it now?
Yes, it's okay. It's okay. Yeah.
Yeah, thank you for that I have the chance to be here today. I will present you some parts of the Biopigee project. It's a project also working on biosecurity, but only on pigs and with a focus on salmonella and actually also hepatitis E control. And it's under the One Health European Joint Program. So the title of the talk is Effective and Prioritized Biosecurity Practice to Control Salmonella in Pig Farming. And yeah, shortly the background, there have been nearly 90,000 salmonellosis cases in the EU in 2019, also quite trustable numbers before the pandemic came. And of these, 10 to 20% of the human cases attributed to pigs as source of infection. And therefore, we are looking for effective measures to reduce the introduction into, within, and also from pig farms. As we realized that there is actually not yet a real definition for biosecurity measure. There's quite much said about biosecurity, but not about what actually a measure is. And therefore we define in Biopigee that it needs to be something active. So it's the implementation of segregation, hygiene, or management procedure. And that means that it's not enough to have a protocol or to have cleaning equipment, but it's also necessary to use it. And when we looked into the literature, that was actually something what was not always in that clear way described. And actually also often it's risk factors being described, but not what actually the preventive part would be. So it was quite interesting to look what we already know. And yeah, we did a systematic review on control measures for salmonella, but also on E. coli, pathogenic E. coli, which is quite similar pathogen, and to supplement here a bit on the knowledge. And we identified 20 effective measures to control salmonella, and actually only 2 for pathogenic E. coli control, and that's related to indoor pig farming. Just a quick view here on the 20 measures. We don't need to go into detail here, just to let you know that these are the 20 ones where we have the point estimate really beneath 1, also the odds ratio normally, and also the confidence interval beneath 1. But there have also some been that were that tended or were close to be significant, but I focus here on those which were clearly having an effect. And I picked out a few of these clear ones, and that's the existence of changing room and having a shower, no feed vehicles enter the farm perimeter, to have clean drinkers, and that's now connected to the last talk, also removal of feces and all in, all out system, And then I added here something from a field study we had also in Biopigee, that's the stay behinds, that they have always been isolated from the healthy ones. Yeah, that's only a few examples, but it shows already that quite big part goes to cleaning and disinfection and also mixing of pigs. And that's actually in concordance with what we found when we interviewed experts and asked them for their opinion on the relevance of biosecurity areas or categories. There were 39 people included with different backgrounds, and they could give or allocate 80 points to different areas. And by that, we could see that they ranked cleaning and disinfection and also mixing highest. Also feeding, water and bedding and purchase related biosecurity, that was also ranked relatively high. So by that, we concluded that most published and also expected effects to control spread of Salmonella and pathogenic E. coli address cleaning and disinfection and also mixing of pigs. Actually also, especially for the E. coli, also the human hygiene. And that means that we expect that action points in these areas may be relevant also for reducing antibiotic use and resistance. But when we are really looking for what needs to be done as measure, then we can see that it's still only very few measures studied and proven to be effective. Here's a figure, and you can see in the orange part for Salmonella that there's still knowledge missing on material and equipment, also purchase and vehicles. And actually also for the feeding part, it's mainly, and water part, it's mainly feed additives that have been studied, but there's very little on other aspects. But therefore, I think it's really good to exchange and increase knowledge and to find key biosecurity practices to control such pathogens in the food chain. And therefore, I'm really happy to have the chance to join this event here today, because I think it's really good to supplement knowledge to each other. Thank you.
Thank you very much for this presentation, Elke Burow. Now I would like to ask the audience and those who are in streaming online to pose questions. Who of the audience has a question to Paolo Ferrari, either to Marcello Molento, or to Joost van der Borne, or to Elke Burow? Please, who wants to pose the questions? Who wants to be the first? Is there a question? Yes, please. Please tell who you are and just.
I'm Giovanni Guadagnini. I'm an Italian practitioner, and I work with pigs. I would like to ask to Joost if the machine that you showed us is also available for pigs, because it's quite difficult thing, the cleaning of the barns and the facilities. And I would like you also to ask if it's applicable also for small farms and medium farms, regarding the cost and the